Hey friends, are you using the silo approach to caring for your low back? And what do I mean by a silo approach? A silo approach is that you only address one aspect of your body, one part of the problem at a time. Maybe you're really focused on the low back and all of your efforts are put into the low back. And you're not looking at other pieces and parts to manage your low back pain. I'm Stephanie Carter Kelly, a physical therapist that uses yoga in just about everything that I do. So, where did I get this silo approach? Well, I'm here in the Midwest of the United States, and I have some agricultural roots. My dad was an agriculture extension agent, which meant he visited all of the farms in our county and gave them advice and solid research methods in farming from the university. So that's what he did. And he brought us as a family along with him on many of those trips. He grew up on a farm. We didn't have a farm, but I always say I grew up on everybody in the county's farm. So I'm curious, what's your background? Do you come from the city? Do you come from a farm? Do you have any agricultural roots? Or maybe now you just like gardening, whether it's flowers or vegetables or fruit. What is it that you love to do? Do you have some agricultural roots? So in this siloed approach, I tend to think of this in a couple of different ways. So our medical system, our healthcare system is really set up to keep us in this siloed approach, right? If you have a heart problem, you have to go see your heart doctor. If you have a kidney problem, you have to go see your kidney doctor. There are very few doctors which really can manage. We have primary care doctors, but what they seem to do is just triage us out to the other people and wait for that specialist to care for us. So that siloed approach is really given to us in our current healthcare system, especially here in the United States. I can't speak for other systems, but I hear that it's similar in other countries. And that siloed approach then tries to break apart parts of the body, parts of the mind, when they really need to be working together. So if you have agricultural roots or you come from a farm now, you know that it really takes all parts working together to have that success, to have that amazing harvest, that bountiful harvest. And it's the same thing for in working towards a problem with your health. So if we talk about low back pain, so many people focus right in on that low back and direct all the attention directly to the low back. My approach sort of backs off of that and says, you know what, let's leave that low back alone. Let's let that area heal. Can we address the hips and the knees as a way to support the low back? Can we address the upper back and the shoulders as a way to support the low back and allow that area to heal? And then how much can we go to the mind and see how our thoughts, any negative thoughts that we have about ourself, about our bodies, how do those negative thoughts impact the low back? How does our memories affect the low back? A lot of farmers have aches and pains. They may have knee pain or they may have hip pain. They may have back pain, but they don't give in to it. Those farmers, because they're entrepreneurs in a way and dependent on the livelihood of their farm, they have to work through a lot of aches and pains. So I think that's okay sometimes to work through the pain, but in a gentle way, not pushing or forcing through it, but allowing ourselves some of the intuition about what the body is telling us, about what the mind is telling us, in a more gentle way to work through it, not to push through it. So the yoga pose that is I'm kind of reminded of in farming or in my own gardening is all fours. And I like to use all fours a lot in all the programs that I have. So, but sometimes all fours is not comfortable for people. One of the first things I tell folks is to get a folded blanket and to put that folded blanket mostly under their shin or just at the top of the knee. Sometimes the discomfort is in the knee and that kneecap. So that kneecap floats out over the front edge of that blanket and makes putting weight on the knees much more comfortable. And so I'm going to back this up a little bit so I'm not running into the... So all fours is an amazing position. Some folks, if you are sitting during the day and keyboarding or typing, you might have some strain in the wrists to come into this position. So the position that we want to try to achieve is the shoulders right over the wrists. But if you can't do that comfortably, then you can shift your weight back into your legs and put less of an angle on those wrists. Spread the fingers and just put some weight into the whole palm of the hand, not just the wrist side of the palm of the hand, but also into the base of the fingers. And, you know, this is just a good position to get in. You want to not sag so much, but have some engaged core when you're in this all fours position. I use this all fours position to do some weeding, to do some digging. I'm on my all fours a lot when I'm in my garden. But to transition from all fours and then be able to sit back into your knees and into your hips, giving yourself a little bit of space in the knees as you sit back, and be able to manage this position too. A lot of people can't get into this position. But you can achieve this position over time as you just kind of ease into it. You can put a pillow back behind your hips so that you don't go back quite as far. But getting that motion into the hips and the knees in order to round out the back is one of the very common poses that we use in yoga in order to get there. To get into that full child's pose. So all fours, progressing into child's pose. What other poses are challenging for you? What other poses or positions are limited by your back pain? Or maybe hip pain or knee pain, and some of that stiffness through the rest of the body is what's affecting your low back. So can we look sort of away from the low back, get out of the silo, get out of the low back silo, and look at the hip silo, the knee silo. But really what we need to do is pull it all together and look at the body and the mind and the spirit as one integrated whole, perfect in every way, that we need to nourish and continue to nourish. So I would love to hear from you. What's your background? Are you in the city? Are you on a farm? Where do your roots lie? What is some of your history around farming or your background? Where did you come from? I'm curious. And how has that brought you to this place that you are right now, challenged with low back pain? I'm Stephanie Carter Kelly, yoga, physical therapist. Namaste.